This series contains real stories from people affected by a poisoning outbreak, including severe illness and death. Some moments may be difficult to hear. Hey, this is Ryan, and this is a bonus episode of A Morel Dilemma. In this bonus, we're going to learn a little bit more about muscarine poisoning, the type of mushroom poisoning you heard Dr. Matt Stanton talk about in episode 2, when we were discussing which mushrooms could cause severe and rapid symptoms that might be fatal. Part of this podcast is investigating a mystery. Part of it is storytelling, and the other part is public health. If we're going to talk about foraging, mushroom poisoning, and outbreaks, I think it's important to also talk about the real risks people might encounter when they're out collecting mushrooms. When we reviewed our poison center data, we found a number of serious muscarine exposures. And as you heard from Matt, this poisoning can be serious, even fatal. So, what you heard in episode 2 was actually a shortened version of a slightly longer conversation where we explain a little more about the types of mushrooms you find muscarine in, what the poisoning symptoms look like, and the mechanism behind the poison. So in this bonus episode, you'll hear Matt and me discuss that case more in depth, talk through muscarine, and how you can potentially recognize its symptoms. Hopefully, this helps you stay a little safer the next time you're out foraging. Enjoy. So here, you'll hear myself and Matt discuss the case and go in depth into the toxicity of muscarine. Maybe it'll help you stay safe next time you're out foraging. Enjoy. The really sick patients in this outbreak had nausea, vomiting, diarrhea, followed by cardiac arrest.
Jeez.
What does it sound like to you?
Muscarine.
Muscarine, right? And you had a case of fatal muscarine poisoning that you were involved in, right?
Yep. A case report I wrote up with Dr. Amy Zolso many years ago on clitosabi mushroom death.
Clitosabi is the scientific name for one genus of mushrooms that can sometimes have this poison, muscarine, inside of it. There are actually a lot of mushrooms that contain small amounts of the poison muscarine, but only a few of the genuses contain much higher levels and are responsible for the most serious poisonings. Their scientific names are clitosabi, like Matt mentioned, and another one called inosabi. But honestly, don't pay too much attention to that. I'll put them in the show notes for anyone who wants to dig into case reports, but those scientific names get reassigned all the time and just create confusion. So instead, let's stick with the common names for these mushrooms: fool's funnels and fiber caps. And collectively, these are often referred to as sweater mushrooms. Not because they look like cozy knitwear, but because they make you sweat a lot.
It was an elderly female. I think she was in her 80s. And shortly after she ate these mushrooms that were picked from her yard, within an hour, she was sweating. And she had nausea, vomiting, and diarrhea. She developed respiratory problems and fluid in her lungs, progressively depressed mental status, and she ended up dying within 7 hours of after her ingestion.
What mushrooms did she pick?
We didn't know initially until her husband went and picked some of the same ones, which were identified from the mycologist as clitosabi, and then there were also some coprinus mushrooms in the ones that he brought in. But then on autopsy, there were some partially digested mushrooms in her stomach that were also identified by the mycologist as clitosabi.
Wow. All of that just from one poison, muscarine.
Yep. So muscarine is structurally related to a main neurotransmitter you had called acetylcholine and works on what we call cholinergic receptors.
These cholinergic receptors that are all over our body that Matt is talking about get activated by the poison muscarine. And when they get activated, they turn on a very important part of our nervous system, the parasympathetic nervous system. This is the rest and digest nervous system. Now, you've probably heard of the fight or flight nervous system. This is its opposite, the yin to its yang. I like to think of it as fight or flight is what you use when your house is on fire, and rest and digest is what you use for house maintenance. It serves a very important role in helping your body absorb energy and secrete fluids that keep your organs clean. All those normal, healthy things you need to do to maintain your body. But when you introduce muscarine into the system, it doesn't just turn it on. It slams the gas pedal to the floor and cranks it to 11.
Sweaty skin, vomiting, diarrhea, pulmonary edema, bronchorrhea, and then either respiratory collapse from there, respiratory arrest, or even cardiac arrest if you get bradycardia.
The muscarinic syndrome Matt is describing that he saw in his forager is a terrifying thing. And only a handful of poisons in the world cause this exact pattern. Maybe you've heard of sarin gas from World War I. That's a nerve gas. Or more recently, Novichok, which was used in the 2018 poisoning of ex-Russian military officers living in the UK. Outside of these nefarious war-related poisonings, we might see this syndrome from highly toxic insecticides and these mushrooms, making it a very important pattern to recognize. And Matt's fatal poisoning is not the only case we've ever had in Wisconsin. If you're really curious, you can look at our publication, which I put in the show notes. But we have had patients show up to the emergency department with dangerously low heart rates and blood pressure and lungs full of fluid after eating psilocybin mushrooms. But they managed to survive because we were able to get them the antidote, a drug called atropine, which blocks the effects of muscarine and was notably absent in Matt's fatal muscarine poisoning. Did they ever give her the antidote?
They never gave her atropine, no. Ideally, giving the antidote would have at least helped some of her symptoms.
By the time you got called, was she already deceased?
Yeah.
In this case, Matt was actually contacted by the medical examiner and wanted to figure out the cause of death. And the patient never had a chance to receive antidotal medications because they unfortunately passed away at home. That's why it's so important to be able to recognize what this poisoning would look or feel like so you can know when to seek care. I know Matt described the medical terminology, but just remember, the signs of poisoning come on quick, and they're all a byproduct of cranking up your rest and digest nervous system. Your digestive system goes into overdrive, you develop vomiting, diarrhea, and excessive drooling. Next up, your rest system goes into overdrive. Your heart rate can plummet, you can become dizzy, and your lungs can fill with those cleaning fluids that help keep them healthy. And all of this together can lead to a fatal outcome. So I want to pause here for a moment because this part really matters. If you ever find yourself sweating, drooling, vomiting, or having diarrhea after eating a mushroom, especially if those are rapid symptoms, call a poison center right away or seek medical care. These symptoms can escalate fast, but in many cases, they're treatable if you get help early. And I brought these mushrooms up because the symptoms we've been discussing in this outbreak, nausea, vomiting, and rapid progression to cardiac arrest, do match the poisoning these mushrooms can cause. But I also brought them up because I know a lot of foragers may be listening to this series. So this felt like an important opportunity to share some public health information that could genuinely prevent another fatality. It's also worth saying that muscarine-containing mushrooms aren't even the most common cause of serious mushroom poisoning in the United States. That belongs to another scary one called amatoxin, which you'll hear about later. But they're just one of many, which is why anytime you have symptoms after eating a mushroom, calling a poison center is a good idea, even if you're not sure if it's related at all. Okay, just remember, if you ate a shroom you're not sure about, a poison center will help you out. So don't fret, you're not alone. You only need to pick up the phone. The help is free, and they will know what's best to do. You just call 1-800-222-1222. Stay safe out there, foragers. See you at the next episode of A Morel Dilemma.